The accessories needed for diagnostic colonoscopy are simple: biopsy forceps, a cytology brush for strictures, perhaps a dye spray catheter. For therapy, the other basic needs are few. Hot biopsy forceps can be for the smallest polyps, a 1 cm mini snare for medium polyps, a 2.5 cm standard snare for larger polyps, and an injection catheter. For sessile polyps, the 1972 Erlangen spring steel snare grips well. A barbed snare is an alternative, and a spiked snare may also help in difficult areas. Whereas the standard snare may slip off sessile lesions, the barbed snare tends to bite into the polyp surface. Impacting the spike of the spiked snare makes sure that it opens and lets it be rotated to manoeuvre over a badly placed polyp. A truly rotatable snare like this one may help for multiple or awkward polyps. The filtered polyp suction trap is best for retrieving polyps up to 6 mm or so in diameter, but a gauze in the suction line works too. And the mucus trap is not so sure but cheaper and good for fluid collection. The plastic polyp suction trap filters off the fluid and can be turned to catch individual specimens, or by turning to naught to allow fluid to bypass the filters. Using a gauze is fine for small specimens, providing bile preparation is good. Retrieval of larger polyps can be with the snare loop. A Dormia basket can hold several specimens, but the nylon Roth net holds many more, whilst the memory metal basket is a good compromise, reusable, strong and unlikely to lose specimens. The endo loop is occasionally invaluable and is easy to assemble. The hook is protruded by opening the handle, the end of the loop attached to the hook, then the handle closed to hold the end, and the protective sheath slid out to cover the open loop. Expose the loop for use by sliding back the protective sheath. Tighten the loop just like closing a snare, although it feels harder. Finally, reopen the handle to protrude the hook and release the tightened endo loop. You can see the collar which slides up and the strangulating pressure it applies. The single-use quick clip is an important accessory to have available for emergency and very easy to use. Just take off the red packing spacer, pull back the outer sheath to expose the clip, squeeze the slider on the handle a little, which opens the clip, then squeeze the handle strongly, with 2 hands if necessary, to close the clip, and open the handle again to release it. The reusable clipping device has a different handle mechanism. Pull back the outer sheath to expose the metal inner coil, press down the black button and push forward the slider to protrude the hook. Attach the clip onto the hook, then retract the hook into the inner coil by pulling back the slider a little. When it's open like this, the clip can be rotated, but cover it for insertion by sliding out the outer sheath again. When the clipping device is inserted and ready for use, protrude the clip by pulling back the protective sheath. Then open the clip by squeezing the handle a little. The open clip can be rotated by turning the rotation wheel. Close the clip by squeezing very hard on the handle, like snaring, but it may need 2 hands. Coagulation devices are also essentials, whether hot biopsy forceps, plastic insulated, the argon plasma coagulator catheter, or the heater probe, Teflon covered. The best stricture dilating balloons are the guide wire variety. They furl up tight enough to pass through a small scope channel, and the guide wire makes passage through the stricture easier and safer. 15 and 18 mm balloons should be ideal. A pressure gun like this is essential to reach the high distension pressure needed, and it can be switched into reverse to deflate the balloon again.